in our previous edition, that is our 7th edition, we had our gestational age. Second was our whether amniotic fluid was clear or not. Third question was how many babies, whether it is singleton or a multiple pregnancy or a tripleton pregnancy. Fourth question was whether there was any additional risk factor, whether mother had any gestational diabetes mellitus, pregnancy-induced hypertension or hypothyroidism, such like additional risk factors whether mother is having or not. Here in our new NRP, here also we have 4 pre-birth questions, but instead of this how many babies, here we have another question called as umbilical cord management plan. So you have to discuss or you have to ask the 4 pre-birth questions that are, first one will be your gestational age. What is the gestational age of the mother? So to categorize the child, whether the child is term, preterm or your postterm. Second, whether amniotic fluid is clear or not. Whether it is clear or it is a meconium stained liquor. Okay. Third question will be any additional risk factors in mother. So additional risk factors can be, I've told you, PAH, GDM, hypothyroid, anemic, such questions. And your fourth question will be, in according to your NRP 8th edition, it is your umbilical cord management. So why umbilical cord management has come into an importance is what is called delayed umbilical cord clamping. So delayed umbilical cord clamping meaning you are clamping the cord after 60 seconds. That is called delayed umbilical cord clamping. According to WHO, this is according to WHO, it is 60 seconds. Well, 30 seconds was previously present in ACOG guidelines, but according to WHO, it is the 60 seconds. So delayed, I'll write it here. Delayed umbilical cord clamping. According to WHO, it is 60 seconds. You do not milk the cord. Milk the cord meaning you will press the cord and bring it till the neonate. You are not, that is called milking of a cord. You are not doing the milking of the cord. You are just doing a delayed cord clamping. That is, you are clamping the cord after 60 seconds of the delivery. Okay, so that is umbilical cord management. So you are deciding whether you have to clamp the cord immediately or you have to clamp the cord at 60 seconds of delivery. Why you are clamping immediately? When the child is having features of asphyxia, or when you are expecting an asphyxiated child, or when the child was in a fetal distress, or when the child is having a meconium stained liquor, or the child is prone for meconium aspiration syndrome. These are the conditions where you do a immediate umbilical cord clamping. So for that you make an umbilical cord management plan. So I'll repeat once again. So the 4 pre-birth question according to your NRP 8th edition. First one will be your gestational age. Second one will be your amniotic fluid, whether it is clear or it is meconium stained liquor. Third one will be the additional risk factors, and fourth one will be your umbilical cord management plan. Fine. Okay, now a baby is born. Okay. So you are asking, you are seeing whether it is term gestation or not, whether the child is in good tone or not. Third, whether the child is crying, that is breathing or not. So 3 questions here are term gestation, breathing or crying, and in good tone. In this 3 is also not being present. It is not present. Okay, the child is not crying. Then you do a initial steps of management. Initial steps of management, you have to do it in an order. That is, you have to warm the baby, dry the baby, stimulate the baby, position the baby, and suction if necessary only. Okay, so this is the order. It is warm, dry, stimulate, position the baby, and the 5th one will be suction. That is only if it is necessary. You do not suction all the baby. Only if it is necessary, you do this suctioning process. So warm, this meaning even before the delivery, you have to pre-warm the towel. That is you're going to receive the baby. You have to pre-warm the towel. You have to on the warmer, you have to set the temperature between 36.5 to 37.5 degree Celsius. This 36.5 to 37.5 is the normal temperature of the newborn. So you have to maintain the temperature between 36.5 to 37.5 degree Celsius. Okay. Next, you have to dry the baby with the towel. First, you are receiving the baby, drying the baby with that towel. That is, you are wiping the baby with that towel. Then you have to discard the towel that is being wet, that we have wiped. That you have to discard the towel, and you have to use another pre-warmed towel. Okay. Next, how you can stimulate a baby? by rubbing the back or by flicking the toes. You can stimulate by rubbing the back or by flicking the toes. You should not beat the baby or you should not pinch the baby. You should do only a gentle stimulate. You have to rub the back or just flick the toes. Then you have to position the baby. In positioning also it is important. You can have a shoulder roll. You can roll the towel and keep it under the shoulder of the baby so that your neck will not be extended too much. You should not extend the neck too much. You have to do a slight extension only of the neck. You have to position the airway. Okay, this is positioning of the airway. Next, suctioning only if it is necessary, only if there is more amount of froth that is being present, you have to do the suctioning. So, suctioning for that, the pressure should be only around 80 millimeter of mercury or it is 100 centimeter of water. So, your suctioning pressure should be only 80 millimeter of mercury or 100 centimeter of water. It should not exceed 100 millimeter of mercury. That one you have to remember. So, these are the initial steps. So, it is warmth, dry, stimulate, position and suction only if it is necessary. So, you have done the initial steps also. The baby has not cried. The baby is in apneic or gasping or the heart rate is less than 100. Next, what will you do? You have to immediately start on with your positive pressure ventilation. PPV is nothing but your positive pressure ventilation. How will you give positive pressure ventilation? So, positive pressure ventilation is by using your bag and mask. By using bag and mask, okay. You have to do a positive pressure ventilation. How many breaths you have to give? It is around 40 to 60 breath per minute you can do it by using positive pressure ventilation. But now we are using another machine called as T-piece resuscitator. So, what is called as T-piece resuscitator? So, instead of using bag and mask, we now use T-piece resuscitator. Why? Because in my bag and mask, when you give the pressure, so you will not, when you are not well trained and you are giving a bag and mask with the increased pressure, this can lead on to a lung injury. The child can develop pneumothorax. So that we use T-piece resuscitator. In T-piece resuscitator, you can set the PIP and the PEEP. So, you can set both PIP and PEEP. So, when you set the pressures, so you will be delivering only the required amount of pressure that will not cause the lung injury. So, since it is safe for the lungs of the child, you use a T-piece resuscitator. So, how much you will give? You will give around 40 to 60 breath per minute. This all should happen within 1 minute of the delivery of the child. So, this step you have to remember. Another one more thing, you have to connect the pulse oximeter also. So, you have two pieces. One is positive pressure ventilation and second one is your pulse oximeter. Okay, so this everything should happen in 1 minute. For first you will do this pre-birth question. There are 4 pre-birth questions. That one is your gestational age, amniotic fluid clear, third will be your additional risk factor, fourth question will be your umbilical cord management. Okay, next. After the child is born, term gestation, good tone, breathing or crying, not crying, then you do initial steps. Warmth, dry, stimulate, position, suction only if it is necessary. After the initial steps also, the child is apneic or gasping or the heart rate is less than 100. Here the another question, your one-liner is, which is the most sensitive marker in your this neonatal resuscitation thing. So, most sensitive marker will be your heart rate, because based upon the heart rate only your next step will be going on. So, when the child is apneic or gasping or the heart rate is less than 100, then you immediately start on with the positive pressure ventilation. So, positive pressure ventilation you will give through bag and mask, or now newer technique is by using T-piece resuscitator. It is around 40 to 60 breath per minute. So, while performing positive pressure ventilation only, you will connect to pulse oximeter also. And another one more important thing here is, while you are giving positive pressure ventilation, that is you will have an ambu bag, that is your bag and mask ventilation. So, in your bag and mask ventilation, you will have a reservoir and you will have an inlet also. So, whether will you connect oxygen or not? That is your third question. I will write it here. So, if the child is more than or equal to 35 weaker, you give FiO2 of 21%. What is 21%? It is nothing but your room air. That is, you will not connect any oxygen supply to your positive pressure ventilation or your bag and mask. Okay. If the child is less than 35 week, then FiO2 you use is between 21 to 30 percentage is the FiO2 you will be using. So it is according to the gestational age. So when the child is more than or equal to 35 week, it is room air temperature. When the child is less than 35 week, that then you use 21 to 30 percentage of FiO2 in this bag and mask ventilation.